We've been seeing an explosion of interest in these new weight loss injections and even tablets called glucagon-like peptide drugs, or GLP-1 type drugs. And children and young people have seen content promoting these sort of weight loss drugs online, according to a report in the UK. Now that's interesting because our teenagers would also be seeing these here with a host of trade names that you'd be seeing on that picture. The report says that almost 1 in 10 of those surveyed may have purchased or taken non-prescription weight loss pills that they have seen promoted online. So that's without a prescription. A few weeks ago, the Minister of Health actually made a statement that there were some fake tablets for weight loss circulating locally. Some gyms have been marketing this. The results on that UK report suggest that many children and young people, especially girls, are being relentlessly exposed to these sorts of diet and weight loss products, despite advertising bans on prescription drugs in that country and in Trinidad and Tobago. The findings in this report were deeply concerning. Not just the kind of products being promoted to children, according to the BBC, but the way in which advertising preys on their fragile sense of self-esteem. And staying along that theme of medications and drugs which have not been approved, men must avoid letting stigma and embarrassment put their health at risk. The regulator in that country has said in a warning about fake pills used for erectile dysfunction, and those have found their way into the West Indies. Many seized pills contained no active ingredient, the wrong dose, or hidden drugs or toxic ingredients. And UK officials seized nearly 20 million illegally traded erectile dysfunction drugs off the market in the past 5 years. And remember that these unlicensed drugs may be especially dangerous for people with heart disease, high blood pressure, or those taking other drugs such as nitrates for heart problems, and thus may increase the risk of having a heart attack, stroke, and dangerously low blood pressure. There has been a phenomenon of intermittent fasting, and some studies are saying now that it may not help people who are overweight or obese lose weight. So that's a review. And the researchers are saying that a popular practice of fasting on some days of the week and eating normally on others may make little to no difference to weight loss and quality of life. However, there have been some smaller trials showing that intermittent fasting could still improve your overall health. Perhaps this term insulin resistance could help with blood sugar or blood pressure. So there may be some helpful changes to certain body functions, although we need, I think, more studies with respect to intermittent fasting. And a recent study also found that people who stopped using those weight loss drugs that I mentioned may put weight back on 4 times faster than those who stop conventional dieting and exercise. So if you stop those injections, the weight may start building 4 times faster. And speaking about fasting, it's the holy month of Ramadan, and we know that fasting is one of the pillars of Islam. It involves no food or drink from dawn or suhoor to sunset or iftar. And a person with diabetes, it's particularly relevant, especially if that individual is taking insulin on some drugs called sulfonylureas, like gliclazide, which is available on CDAP, that stimulates the pancreas to make insulin. Those who have a long duration of diabetes, or if you have problems with your kidneys, this can change everything metabolically. Ramadan creates 2 risk windows, because sometimes your sugar may drop low in the late afternoon, and if you're eating ravenously at iftar, so that's the meal in which you break the fast, the sugar may then spike. It's important to recognize some of the symptoms of low blood sugar or hypoglycemia: sweating, nervousness, shaking, confusion, dizziness, palpitations, and if severe, there may be blackouts or seizures. So I want to say clearly, if your blood sugar drops low, you must break your fast. And similarly, if your sugar is very high, the symptoms may include excessive thirst, frequent urination, blurred vision, fatigue. And very high sugars, of course, increase the chance for dehydration. If you're a person with type 1 diabetes, your doctors would sometimes mention about a risk known as DKA, or diabetic ketoacidosis, which would require admission to hospital. And in very hot climates like Trinidad, there may be a risk of another problem called HHS, and that is hyperglycemic hyperosmolar state. It's a mouthful, but it's a complication associated with type 2 diabetes in particular when poorly controlled. Some other risk factors may be those at extremes of age, persons who are on water pills or diuretics, and we mentioned if you've had problems with your kidneys, that these long periods of fasting, particularly during the hot, dry season, may increase the chance for complications ranging from blood clots, dizziness, and falls. Has been said that certain people are exempted from fasting, and these would include type 1 diabetes, those who have had severe hypoglycemia, very bad low blood sugar readings in the past 3 months, that complication called DKA in the last 3 months, if you have advanced complications like with your eyes or kidneys, pregnant women, of course, with diabetes, if you're very old and frail, or uncontrolled diabetes, if you do a blood test called a hemoglobin A1C, that's your sugar for the preceding 3 months. If it's exceeding 9%, you'd want to remember that in those situations, fasting may be dangerous. And high-risk persons would include those individuals with poorly controlled type 2 diabetes, if you're taking multiple insulin injections, and with significant medical problems. So you should only fast with medical supervision. Low-risk persons may include those who are well-controlled type 2. If you're on a drug called metformin, you may want to switch the time, perhaps at iftar, when you're breaking the fast. And those persons with diabetes without significant complications. But we always advise that have a chat with your doctor even before the month of Ramadan starts, because it's a time for increasing education and monitoring. There's another important statement that checking your blood sugar does not constitute breaking of the fast. And many people mistakenly believe it does. So you'd want to consider perhaps checking your blood sugar before suhoor, at midday, late afternoon, and perhaps 2 hours after you break the fast. And as we mentioned, break the fast if your blood sugars are very high or low, if you have severe dizziness, confusion, vomiting, chest pain, or severe weakness. Breaking your fast for safety is not weakness, it is wisdom. And he does not want to put us into difficulty. In hot weather, dehydration risk doubles. In diabetes, it triples. And if you're dehydrated, that's in which your fluid loss is greater than your intake. You may want to watch for a reduced frequency of urination, headache, muscle cramps, and dark yellow urine. Faith does not require self-harm. Islam provides exemptions for illness, and choosing safety is not spiritual failure. The goal is not to choose between faith and health. The goal is to honor both. It's time for a short break, and when we return, the Kiddies capsule awaits. Don't go anywhere.
Folks, take a look at all these medical conditions. What does it have in common? This, itis. But what does itis really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
Itis really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488, 701-6680, 728-6786, or visit our website to order.
Mom, Dad, this is Trevor.
Hi. He's no Kieran. Back up.
Fling? That's why he crossed the road. It was funny when Kieran said it.
Oh, who could that be?
We're like the parents who don't miss your ex.
I can't believe Kieran is in the neighborhood.
CG United. Good like that.
Get a free pair of polarized sunglasses with the purchase of new Gen S Transitions lenses with anti-reflective coating and frames. Selected designer frames now just $4.99 with additional promotions. Hurry, limited time only at Seaview Optical.
Looking for a completely natural way to supplement your family's diet? Only BioStrath gives your body more than 60 of the essential nutrients it needs every day in a product that's 100% natural, so it's more easily absorbed. For stronger immunity, enhanced focus, increased energy and stamina, and faster recovery. BioStrath, get what you need naturally.
We are your one-stop, most convenient, most helpful, most caring community pharmacy. Our pharmaceutical services include dispensing medicines, repeat dispensing, clinical governance. But we also have a fully stocked convenience store featuring our refreshment aisle, grocery lane, personal care products, toys, pet supplies. We are most conveniently located out of the traffic, just 2 minutes off the highway in Heartland Plaza in Deba Chaguanas. Contact us on 220-8705 or 470-5938 and visit us soon.
Welcome back to CNC3's Ask the Doctor. So while the older persons are busy arguing about cholesterol and cortisol, the real VIPs of health are the little ones. This is where we turn big medical ideas into bite-sized brilliance. Simple, smart, and sometimes a little bit silly, because healthy habits start young. So parents, lean in. Children, sit up tall. And let's learn something today that your future self will thank you for in this evening's fan favorite Kiddies capsule.
Why breakfast is called the most important meal of the day? Well, breakfast means to break the fast. When we sleep, our bodies go many hours without food. That's right. While we are sleeping, our bodies are still working. Our hearts are beating, our lungs are breathing, and our brains are organizing information. By morning, our energies are low and needs to be replenished.
Eating a nutritious breakfast restores glucose levels. Glucose is the brain's primary source of energy. Without it, we may feel lethargic, irritable, and unable to concentrate in school.
A well-balanced breakfast should include carbohydrates for energy, protein for growth and repair, healthy fats for brain function, and vitamins and minerals for overall wellness.
Research shows that children who eat breakfast will often demonstrate improved memory and sharper concentration.
So start your day the smart way and never skip breakfast. This is your Kiddies capsule.
Hello, my name is Vincent and I attend Specialist Learning Center. Today I want to talk about fevers and chills. When your body feels hot to the touch, but you still feel cold or have chills, that's often a sign of a fever. Our normal body temperature is around 57 degrees Celsius, and a fever is when that temperature rises to 48 degrees Celsius or higher. A fever usually means that the body is fighting an infection or even inflammation, and sometimes the brain tells the body to make more heat to eradicate what's making you sick. This causes shivering. When you have a fever, rest, drink fluids, avoid overheating, and seek advice on how to keep that fever down. Understanding fevers helps us take better care of our health at any age. That was your Kiddies capsule. Have a great night.
And we say a special thank you to all involved for those pearls of wisdom. And indeed, birthday blessings to Miss Naya Surat Singh, who has a special day tomorrow. It's time for a short break, and when we return, it's the Medical Minds segment. Get ready for that.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
Okay, let me see you Cherry Hill. Yeah, now take it back. Let me see you rock off, shake off. Let me see you rock off. Let me see you kick right. Now step forward, now step back.
Lucozade, bring the energy. Unbeatable taste, new look.
Shake off. Let me see you rock off.
At Cruise Inn Hotel and Yachting Center, we're all about time. In fact, once you check in, there's no time to lose. Reconnect with a little family time. Make a splash with some pool time. Spend some treasured quality time, or just immerse yourself in some quiet time. Indulge your senses at dinner time. We even have the perfect venue when it's your celebration time. So it's high time you visit Cruise Inn. Choose our day pass or call 607-4000 to make your dinner or hotel reservations, or to find out more about our event spaces. Take a time out at Cruise Inn Hotel and Yachting Center.
Struggling with blood sugar swings, high blood pressure, or stiff joints? Take control with Aja Nutrition's powerful wellness trio. Berberine Plus supports healthy blood sugar. Blood pressure support helps keep your pressure in check. And Joint Aid keeps your joints moving so you can stay active every day. Don't wait. Choose Aja Nutrition for trusted, effective solutions. Available at Pennywise and leading pharmacies nationwide. Feel better, move better, live better with Aja Nutrition.
And welcome back to your number one show for news, views, and interviews of all things medical. Teeth whitening has become widely popular. Social media promises instant brilliance. Strips, gels, lasers, home kits, the options are endless. But here's the real question. Are we brightening safely or bleaching blindly? To guide us through the science behind whitening, the myths, the risks, and what actually works, Dr. Dion Kunulal joins us on this evening's Medical Minds.
Hi, I'm Dr. Dion Kunulal. Thank you to Ask the Doctor and Dr. Tilak Singh for having us. Today, we're talking about teeth whitening because plenty of people want a brighter smile, but I want you to get results that look natural and, most importantly, keep your teeth healthy. First thing to know, whitening works best on your natural teeth. So if you have fillings, bonding, crowns, or veneers, those won't whiten or lighten the same way. That's why some people whiten and then notice one tooth looking different. A quick check beforehand helps us plan properly. Now, why do teeth get darker in the first place? Most of the time, it's everyday staining from coffee, red wine, certain foods, or smoking. Sometimes it's just your natural tooth shade, and sometimes what people really need isn't whitening at all. They just need a professional cleaning first, because stain and buildup can make your teeth look dull. So let's break down your main whitening options. Nice and simple. Option 1. Over-the-counter products like whitening strips and whitening toothpaste. These can help with mild staining, but results can vary and you have less control. Option 2. Dentist-provided whitening trays for home use. This is usually more comfortable and more consistent because it's planned around your teeth, your sensitivity level, and the result you're aiming for. Option 3. In-office whitening. This is done in a controlled setting and can give a quicker change, but it's not a one-size-fits-all. The right option depends on your teeth and your goals. Now, here's the real side effect people should expect. Temporary sensitivity can happen. Some people describe it like a quick zing. You might get a little gum irritation if the product touches where it shouldn't. Most of the time it settles quickly, but that's exactly why guidance matters. And please, don't get trapped by every online trend. If something feels overly harsh or abrasive, it can end up doing more harm than good. Whitening should never feel like you're scrubbing your teeth into brightness. We want to protect your enamel, not to wear it down. Now, who should pause and get checked before whitening? If you have tooth pain, bleeding gums, a broken tooth, or you suspect you have a cavity, please pause. Let's fix it first, then we whiten. And for parents, if a child or teen is asking for whitening, don't rush it. It's better to get proper guidance and make sure it's safe and appropriate. So, what do I recommend for the best result? Step 1, a proper assessment so we know what we're working with. Step 2, a cleaning first is needed. Step 3, choose the whitening option that fits your teeth and your comfort level. Step 4, maintenance. Because whitening isn't magic. Your habits matter. Small changes like rinsing with water after coffee, using a straw for certain drinks, keeping up with cleanings can help your results to last longer. If whitening is something you've been thinking about, you don't have to guess and experiment on yourself. Go into your dentist and have a quick consultation, and I'm sure they will guide you to a brighter smile that looks like you. I'm Dr. Dion Kunlal, and thank you for watching. Take care of your smile.
And we say a special thank you to no stranger to ask the doctor and to the entire Kunulal family. Thank you for your love, service and support, and indeed wise advice on teeth whitening. Coming up next, you know the drill. One question, one right answer, and you could be our next lucky winner. From healthy joints and a happy heart, with prizes you love. The giveaway segment with the compliments of Great Health Works is coming up next.
Eye care tips for Seaview Optical. Eat well. Good eye health starts with the food on your plate. Nutrients like omega-3 fatty acids, lutein, zinc, and vitamin C and E might help ward off age-related vision problems. Quit smoking. Makes you more likely to get cataracts, damage to your optic nerve, and macular degeneration. If you have tried to kick the habit before only to start again, keep at it. Wear sunglasses. The right pair of shades will help protect your eyes from the sun's ultraviolet UV rays. Use safety eyewear. If you use hazardous or airborne materials on the job or at home, wear safety glasses or protective goggles.
Get a free pair of polarized sunglasses with the purchase of new Gen S Transitions lenses with anti-reflective coating and frames. Selected designer frames now just $4.99 with additional promotions. Hurry, limited time only at Seaview Optical.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Step into ABC Doors and Windows, where quality meets variety. Discover premium wooden, steel panel, fiberglass, and steel security doors alongside aluminum, UPVC, and steel windows designed for strength and durability. At ABC, we're always a better choice, delivering products built to last and service you can rely on. Visit our showroom at 1 Chanka Trace, El Socorro South, or call 638-7184 to make your dream home a reality. Gaming Express Limited is a premium importer and retailer of the highest quality brand name electronics. We stock the widest range of PlayStation, Nintendo Switch, Samsung, and Apple devices and accessories. Visit us at Shop 52, Level 2, Gulf City Mall in San Fernando, or contact us by phone or WhatsApp message at 687-7480 or 301-9797 or 798-1280. Like our Facebook and Instagram pages for updates on products and services.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Welcome back to CNC3's Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. It's giveaway time with the compliments of Joseph Sendel and the rest of his brilliant team at Great Health Works. And the numbers on the screen, we'd love to hear from you. As a reminder, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. So, if you can tell us the answer to this question, post-carnival I thought would be relevant. So it's a hormone, these messengers which are produced by glands, transported into your bloodstream. The hormone helps your kidneys conserve water, but is suppressed by alcohol and could create that extra layer of dehydration. So, you know, as part of the carnival celebrations, extreme heat, reduced intake, you're sweating, and then you add alcohol on top of it. So it's involved with conserving water, but alcohol blocks the effect of this particular hormone. I'll give you a hint. The acronym is ADH we're looking for. There are a few other names, but we'll accept ADH. Hello, good evening, and welcome to Ask the Doctor.
Hi, good evening.
Thank you for being part of our Ask the Doctor family.
Thank you.
Do you have an answer to this evening's question?
Is it phosphorine?
So you may have to say it, because that is the other term for ADH. So one of the terms ADH, but I'd like you to get the right word. If you could spell it, even better.
VASOPRESSIN.
Vasopressin, or antidiuretic hormone in this case, ADH. Congratulations, released from the posterior pituitary gland, that master gland in the brain. Well done. Diuretic, of course, is usually something that may stimulate the production of urine, so the so-called water pills, and antidiuretic hormone to conserve water. Congratulations.
Thank you.
Have you used these supplements before?
Yes, I have.
All right, so stay on the line, because we want to take some of your personal information off the air. I hope you've had some positive results thus far. And once more, thank you for being part of our program. Antidiuretic hormone, as the young lady said, vasopressin, another name for this particular hormone produced by the body, involved with water retention, and so key when we're thinking about reducing the risk for dehydration. Right, the open forum is up next, because it's time for you to take center stage. Whether you're seeking advice or just some clarity, your turn is coming up next. Stay with us.
Excuse me.
Fast Track food supplements for vitality and well-being.
Ahad One General Store is your trusted destination for tactical gear, accessories, lifestyle items, and more. Step up with tactical boots, protective vests, helmets, explore outdoor gear, utility essentials, and premium Attar perfumes, alongside elegant Islamic wear, jewelry, ornaments. Discover toys, RC vehicles, electronic scooters. Visit us in Charleville, Shogunas, or shop online at ahad1.com. Delivery available. Ahad, more than a store, a lifestyle destination.
Get a free pair of polarized sunglasses with the purchase of new Gen S Transitions lenses with anti-reflective coating and frames. Selected designer frames now just $4.99 with additional promotions. Hurry, limited time only at Seaview Optical.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Welcome back to CNC3's Ask the Doctor. It's the open forum with questions of a medical nature. We'd love to hear from you. And as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set. And of course, please allow me to extend birthday blessings to firm fans and viewers of the show. Shaliza Makunja from Central Trinidad has a special day this week, and Mrs. Shanez Khan of famous Nick's Bread and Jana, she has her birthday in the month of February. Certainly love and blessings to both. Right, I believe our first caller is on the line from Princess Town. Good evening and welcome to Ask the Doctor.
Good evening, Doctor.
Thank you for joining us, sir.
I would like to know a person who is suffering from cirrhosis of the liver.
Yes.
NASH. What tests there are to determine whether there is a regression or a deterioration of the condition of the liver if they are trying the medicines that are available, like the Milk-Pistol and the Nutrasect and what have you. What test is available to show that we can know the status of the liver? I will listen to you off air, Doctor, and you have a great evening and a wonderful weekend. Thank you.
You are most welcome, and same to you and your lovely family. I recognize that booming, distinguished voice as per usual from Princess Town. So he brings to the forefront to do something very interesting, because the commonest cause of cirrhosis of the liver when it becomes fibrosed, scarred, and damaged is actually no longer alcohol. It is becoming those fatty changes, or what we now call metabolic associated changes. So there may be fat accumulation, subsequently inflammation remains the hallmark, and then damage. So the end stage is cirrhosis, and at that point you would be under the care of a gastroenterologist who deals with problems affecting the gut, inclusive of the liver or gallbladder. So there are medications which may actually delay the progression, some of which you mentioned, which could involve a cocktail of B vitamins and an herbal remedy called milk thistle. Of course, but the evidence is very limited. We always advise that you want to ensure that your diabetes is under immaculate control, because so many persons, particularly with type 2 diabetes, also battle the ravages of a so-called fatty liver. And of course, if your cholesterol is elevated, your doctor would would be monitoring your liver function tests to ensure that the extent of damage will be monitored. The liver is involved with the production of certain clotting proteins. So there's actually a clotting profile involving the PT, the PTT, and a so-called INR. So those abbreviations would give a mark or two in terms of synthetic liver damage. So you're looking at the amount of protein that is made by the liver, because if that's low, it's sometimes a clue. There is a mathematical formula, would you believe, that doctors often use. A few weeks back, we had a gentleman who phoned in about the GFR, the glomerular filtration rate, with respect to kidneys. And there's also a mathematical formula based on those basic liver function tests involving the enzymes, and that can calculate the extent of damage. There's actually a special type of scan that some of the gastroenterologists perform, and then in the latter stages, if they are unclear, a liver biopsy. Now, all persons who progress to cirrhosis of the liver, and we're talking about those who do not indulge in large volumes of alcohol, may not have cirrhosis of the liver due to fatty changes. So you may also want to consider a hepatitis screen. There are certain viruses, and these are known as CMV or Epstein-Barr virus, which may also inflame the liver. And would you believe sometimes antibodies actually attack the liver? We've spoken about some of the quintessential immune-mediated problems, such as the thyroid or type 1 diabetes. There are also immune problems that may affect the liver, particularly in younger people. So blood investigations would remain the first stage, an ultrasound or CT scan, followed by this mathematical formula called the FIB-4 index. And a special scan may then be employed to assess the degree of damage. A liver biopsy could be considered if there's still uncertainty. And then if there is progression to cirrhosis, most importantly, you're looking at some of the complications, particularly bleeding from the gut, low blood sugars, and liver failure. Fascinating question, because as we stand on the threshold of newer drugs, those GLP-1 receptor agonists that I spoke about in the opening monologue, those drugs don't just help weight loss. Many of these actually are approved in the management of fatty liver disease. So diet, as well as exercise, management of your diabetes, your high blood pressure, cholesterol, consideration of those drugs. And there's even a novel agent. If you Google this fatty liver, or MASH is a new acronym, you may actually see there's a new agent approved by the Food and Drug Administration for the management of a fatty liver. Our next caller hails from St. Augustine. Good evening, and welcome to Ask the Doctor.
Yes, hi, good night, doctor.
Welcome, ma'am. Thank you for being part of our program.
Yes, if someone is getting numbness in their feet, what can be causing that, and also what they can do to solve that problem?
Yes, ma'am.
Especially at night.
Yes, ma'am. Thank you for being part of the show, because it's a superb question, such a common phenomenon. I'm not attempting to make a diagnosis on the basis of a telephone call, of course, but just to nudge you in the right direction. Because some people may have a numbness to their feet or fingers, sometimes burning, lancing, a pins and needles sensation. Many of our viewers would nod sagely when they hear an old term, junjuni, and it may represent damage to the nerves, those smaller nerve fibers. The medical term is neuropathy. The commonest cause is diabetes, but it is by no means the only reason for this particularly vexing problem. Sometimes if you have nerve impingement to the lower back, patients may find that the symptoms are referred to the feet, and this may radiate down the buttocks and legs. If you have a low level of vitamin B12, if you have some of the antibodies attacking those nerves, or immune-mediated problems such as lupus, if you drink large volumes of alcohol for an extended period of time, or if you've had treatment for cancer or the disease itself. an underactive thyroid, or even genetic problems. Despite our best efforts, when we send people for a battery of tests, we sometimes would be unclear as to why they have these nerve-related symptoms. A referral to a neurologist for perhaps nerve conduction tests after a history, physical examination, and a thorough battery of blood investigations to rule out some of these common causes would be initial stages. Then some patients use high doses of B vitamins once more, but the evidence is limited in the absence of a deficiency. But certainly, if there is a problem, you'd want to correct it. If you look at your levels of vitamin D and low, sometimes they may help problems like muscle cramps or weakness. And physiotherapy, if there are issues to the lower back. We would consider if there is numbness to the waist, if you're having changes to your bowel, bladder, or sexual function. That problem may arise from the lower part of the spine, and a scan may be warranted. So there are multiple reasons. It's difficult to treat, unfortunately. For persons who have painful neuropathy, perhaps some of the drugs include pregabalin, gabapentin, duloxetine. There's even an older one available on CDAP, but amitriptyline. And this should only be done in conjunction, of course, with your doctor. So a stepwise approach is certainly warranted. You want to determine the cause of these, of the numbness or the nerve involvement. You then would want to consider some basic investigations. Consider referral to neurologists and their clinics close by to you at Mount Hope, and then appropriate treatment if needed. As we head further east, as Arima is on the line, good evening and welcome to our show.
Yes, blessing to you, Doctor.
Love and blessings to you, sir.
Very learned and knowledgeable doctor you are.
What a delight to have you.
Thank you for all the information, sir. You're making plenty healthy again.
It is a pleasure.
Not too long ago, you was talking about, about fasting, and not too long ago,
yes, sir.
I was carrying a trip to Arima, and they told me to, the first pala we meet, stop, I want to get a soft drink. So I told soft drink loaded with sugar, and soft drink is not good. He said, well, yes, I have to get them soft drink, not because my sugar is low and I could get dizzy and faint away. I say, okay, well, if that's the way, I'll stop. So, and earlier now you was talking about fasting, which is very good, but it could be dangerous too. And a lot of people didn't know that when you fast, it could cause a lot of problems later down the road. And thank you for all the information, Doctor. You're well learned. Thank you, sir.
And you're most welcome, sir. It's an honor and a privilege to be a part of this show. And thank you for always being a firm fan of our program. So it's a reminder, particularly in persons who have a history of diabetes. So there is a nuanced approach when it comes to prescribing or the utilization of drugs. So if you've taken a shot of insulin, or if that individual would have taken a medication for high blood sugar, there's always the risk that it may become low. So the medicated person with diabetes may find that hypoglycemia or low blood sugar is sometimes a complication, and it may be heralded, just to reiterate, by sweating, nervousness, anxiety, palpitations, dizziness, hunger, confusion, and then some people don't even have those warning signs. They are unaware when the level is falling, perhaps less than 70, and those persons may actually present to hospital with a medical emergency, ranging from confusion, seizures, and even stroke-like symptoms. So it's easy to rectify with something sweet, perhaps a half a glass of a sweetened drink, some form of sweetened sugar. I remember in England that the consultant I worked with, who was a diabetes specialist, would always ensure his persons who were taking insulin had something sweet on their person, perhaps in their purse, on their pocket. If there was a complication at hospital, they could check their sugar. There is a term called the rule of 15s. In the pharmacy, they actually sell glucose tablets for that reason, that 15 grams of glucose, check your sugar, and 15 minutes later, it should have rectified. So if you're having signs and symptoms, you take something sweet, and I would always advise, because these symptoms are non-specific. Sometimes people say that they're weak, and then when they check their sugar, it's not actually low. It's interestingly very elevated. So weakness alone may not be a symptom of a low blood sugar. As we stay in the east, as Dabadi's on the line, good evening. Welcome to Ask the Doctor.
Hi, good day. Are you able to hear me properly?
Loud and clear. Thank you for being part of our family this evening.
Thank you very much for having me. Want to get some information, if I could, from you.
Yes, ma'am.
What could cause a person to be feeling as though they are having pain in the foot, like if it's actually needles around the ankle area, immense pain? So you're taking high levels of, ibuprofen, antibiotics. You had venous insufficiency on another part of the foot. You did the stripping of the vein, but you're still having this pain that is excruciating and you can hardly walk. And you did a inflammation test, I think it's ESR, and it was high.
Yes.
So that's what I wanted to know, some guidelines as to what could it be, or which kind of doctors could help with something like that.
Yes, ma'am. Thank you very much, because that is a relevant question tied into the call that dealt with numbness to the feet, because that pins and needles sensation, and you can hear that it affects the quality of life. It's excruciating and can even contribute to depression and anxiety, because it sounds like it's nerve-related pain. And some of the basic anti-inflammatory drugs, such as Brufen, will not be so effective, but the ibuprofen or paracetamol may not be the best drug of choice for someone with nerve-related pain or neuropathy. And just to remind you that the reasons are legion. They range from diabetes, a low level of vitamin B12, history of alcohol use, cancer, the treatment for cancer inclusive of chemotherapy or radiotherapy. If you have immune-mediated problems, that may cause the inflammation marker to rise. For the sake of our viewers, the ESR, erythrocyte sedimentation rate, is a non-specific marker of infection or inflammation, but autoimmune problems, including lupus or rheumatoid arthritis, may cause that level to be high. So your doctor would want to delve further into not just prescribing a drug such as pregabalin, duloxetine, or gabapentin. Consideration should be given to doing a battery of blood investigations, and then a neurologist. There are actually special tests called nerve conduction studies that may be performed to elucidate the diagnosis and then appropriate treatment. Our next caller hails from Aruka. Good evening and welcome to our show.
Hi, good night.
Welcome, ma'am. Thank you for being part of the program.
Sure. I have some questions to ask you, right? I'm calling on behalf of my aunt.
Thank you for doing so.
She has pain in her knees, and her knees are unable to bend. So I want to know what could be causing that pain and which doctor should she visit. She visited a couple already, and they told her it's arthritis, but the pain is there, and she's not able to bend the knees at all.
Yes, ma'am. Thank you very much for taking the time to call in on your auntie's behalf. And the word arthritis refers to joint inflammation. And many people, as a result of wear and tear, there will be degenerative changes. Sometimes it may be diagnosed on an X-ray. So if she was a sportswoman, sometimes you might even step up to a special scan by the MRI of the knees. Now, stiffness, pain, swelling, a reduced range of motion, and problems walking could all be symptoms of arthritis. We talk about things like weight loss and some of the basic anti-inflammatories, whether topical or by mouth, as being the initial stages. Some blood investigations to determine if there are other reasons for her joint inflammation. We spoke about the ESR. Is it rheumatoid arthritis? Is it due to high levels of uric acid? Perhaps a flare of gouty arthritis? It's unclear. Seems like having a chat with her primary care doctor, a referral to a physiotherapist to determine whether or not an orthopedic specialist is the next step, maybe at Mount Hope or Rima Hospital. That would be the right line of approach for someone who's having joint pain, stiffness, and a reduced range of motion. And we wish you all the best, and thank you once more. God's blessings to all of the members of the Open Forum this evening. Because, boy, parting is always such sweet sorrow. The phone lines were burning up, and our closing quote is from the classic The Prophet. Khalil Gibran, that renowned Lebanese-American poet and writer. Your body is the harp of your soul, and it is yours to bring forth sweet music from it or confused sounds. Now, if the body is the harp, then how we live determines the music. Rest creates harmony, but stress creates tension. Neglect creates discord. The question is not whether your body is playing, it's whether you are listening. Health is not noise like carnival, it is rhythm. Thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my team behind the lens, to the incredible Neela and baby Daniel, and to you, our viewers, stay strong, stay curious, and never stop choosing kindness. Rest, reflect, love deeply. God bless, and we'll see you next week on Ask the Doctor.